Hey everyone, I'm Colby Weichert, and today we're going to be discussing shoulder rehab for an AC joint separation. AC joint separations occur to those who are in contact sports such as hockey, football, you name it. It occurs when a player, or any person in general, takes high trauma to their shoulder, which results in a tearing or sprain of the ligaments. These ligaments connect the acromion and the clavicle together. When they're torn, they separate, resulting in a bump on the shoulder and extreme pain. Today we'll be discussing a baseball pitcher who happened to be batting as he took a slide, landed wrong on the top of his shoulder, and got an AC joint separation. My partners Kenzie and Kaylee will be discussing the injury phases and how to deal with them. Thanks for tuning in, and have a great one.
Initial injury phase. So the principle that we will be using for this is the RICE, which is rest, ice, compress, and elevate. For rest, we will rest for 3 to 5 days, and then we'll apply ice or cold therapy. After that, compression, which can either be done through an A-strap or brace, and the two different types of braces are shown. You need to do this as soon as possible to reduce pain and swelling. When you're wearing a brace or a sling, it's to immobilize the shoulder to ease pain by taking some of the weight off of your arm. This lasts for about 3 to 7 days. Also, a professional can perform a cross-friction massage. This may be applied to the injured ligaments a few days after the swelling and bruising has gone down. This will soften the scar tissue.
The duration phase can be different due to the type of dislocation occurred to the baseball pitcher. AC joint separations usually don't need surgery if you have type 1 or type 2 dislocation. If you have a type 3 dislocation, it will usually be up to your doctor to determine if surgery should be considered due to the amount of damage in your shoulder. The first step we will do is to immobilize your shoulder, and we will be using either a sling or a collar cuff to do that, and that will help release the pain so that we can start early stages of range of motion. And you will be usually wearing the sling or a collar cuff for 1 to 3 weeks due to the amount of pain.
Reception phase. Reception phase. It is to restore balance, stability, and your limbs through a range of motion. So meaning that your limbs can go through a range of motion. This means that you will need to continue this phase until there is no pain moving through a range of motion, and you can move fully through that range of motion. This phase usually lasts for about 1 to 6 weeks. And then to answer the question of how often should you do the stability and stretches, they should be done on a daily basis if there is no pain during, after, or the next day. Exercises must be done regularly to continue through the rehab process and beyond. Next, I will demonstrate 4 different stability movements and stretches. For the second one, you're going to need a door frame, and then you're going to put your hand up and then slowly turn away. This is stretching, but also fixing the muscles, and you're going to do this for 10 to 20 seconds 3 times. For the next exercise, you're going to have the person that's hurt lay down, and then they're going to put their arm at 90 degrees and have their palm facing up, and then I'm going to grab their elbow and their wrist, and you slowly push down and back. And this stretches their AC joint, and you hold this for about 10 to 20 seconds, and you do this 3 times.
The strengths we will be using is extension, flexion, abduction, and adduction, and the images to the right show those types of different exercises to be used. And during these, in the photos, it shows he is holding either like a rod or some type of pole. So it has like some little weight
Endurance phase. The endurance phase can last up to 6 weeks after the initial injury or 2 years after the initial injury. Some of the examples for the endurance phase is biking, one-armed biking if it's a shoulder injury, and running. These should be done without pain while the injury point is stable. These exercises should progress in length and severity until the athlete is prepared to focus on their return to their sport.
For sports specific, the image to the upper right corner shows the amount of degrees, so 180 degrees, a pitcher throws. So that is our end goal, to be able to get that pitcher back into 180 degrees. And by that, we will do different types of range of motion specific for the pitcher. And these you will use either a medicine ball or some type of heavy object. I just chose to use a hydro flask because it had some weight to it to feel some strength going on. And here you will want to drop the medicine ball, as for me, hydro flask, all the way to the floor. And here you'll want to use either like a weight or some type, again, a medicine ball,